Okay, so we're live. Hi, Supernaturals. It's your host, Beverly Hines, founder and CEO of Hair Scripts, the platform that is connecting you if you are experiencing hair loss issues to trichologists and dermatologists and other hair experts for treatment and support. I am very excited about our guest today, Dr. Shari Hicks-Graham. She is going to be talking about the top 3 disorders on your scalp that you should be focused on and how to treat them. And then we're going to have some goodies that we're going to talk about, some really great products that she has in the market, on the market right now that are really good for dandruff and itchy scalp. So let's just jump right in. Dr. Shari Hicks-Graham, do you mind telling us a little bit about yourself before we jump into the topic, and how did you get to this point?
Yeah, certainly. Thank you so much for having me. I'm really honored to be with you today. I think your platform is fantastic, and it's one of my favorite subjects. So thank you very much for inviting me.
Thank you.
Yeah. So I am a board certified dermatologist practicing in my own private practice in Columbus, Ohio, where I've been, practicing for the last 15 years. It'll be 16 this year. I can't believe it. And over that period, I've developed just a deep, real attraction for hair disorders. And I think that the reason for that is because when I first started working here, I just met a lot of patients who would come to me complaining about hair and scalp issues. And most of those women at that time were of African descent. Okay. And so I began to just kind of realize that this was a real thing. And, taking a step back, when I was training in residency out in Los Angeles in the early 2000s, we would see hair disorders, but it really seemed to accelerate after I became present in private practice. And I began to question kind of why that was, and became fascinated by the issues.
So and that's funny that you said you question why, because that was my first question. Why do you think that is, that disorders accelerate, especially in, African-American or Black people?
I know. So it's a really troubling question. Why do we have this burden? And I think a lot of it has to do with, number one, we're learning that it can have to do with genetics. Okay. So there are now genetic traits that we found that can be associated with a particular type of hair loss that happens right up here on the crown, called central scarring alopecia, or otherwise known as central centrifugal cicatricial alopecia. And I call that, kind of public enemy number one. Wow. For women of color and men also, who wear hair in various styles, whether it be natural, relaxed, locks, occasionally braided with extensions or weaves. It really can be something that we all have to worry about, because it can cause permanent hair loss over time. Okay. And that was really something that I have, been struck by. And while there's a genetic component that we understand, we also know that it can be linked to certain hair care practices. And so those are the things that we really can impact and try to mitigate. And so that's where my focus lies.
Right, because I like to address hair loss and hair disorders as kind of prophylactic treatment, prevention, and then of course treatment, right? And then maintenance. And so my first question is always, if there's a specific disorder, like, you said central scarring alopecia, if we're not all of us, but if most of us are genetically predisposed, how do we mitigate that? What is one main way that we can mitigate that?
Yeah, so the main thing is to just know that if you do things to your scalp that hurt, you can have problems. I mean, it's just as simple as that. If we continue to put our hair in fixed positions, fixed styles with tension, and if initially for days it hurts, that's probably an issue. And that's something that we can easily step away from and avoid. Okay. I think that from a young age, and this is personal, right? I mean, we all know what it feels like to get your hair done and have it hurt.
Right.
And if we don't do it now, we remember some time when it did. And so we know what that's like. And so this problem is so complicated because it's also cultural. And it's about, how do we feel pretty, right? Like, how do we, what makes us feel pretty? What makes us feel our best? How do we feel like we've really got it going on, when it comes to our hair? And I think culturally, I've always said that sometimes we mistake like a tight style for a neat style. And I think the goal culturally for us sometimes is to feel like, okay, we got it in place. We are together. We are tight. We have it tight, and that for like that word tight culturally is like, okay, she's got it going on. She's got it together. And I think it can translate it into our hair because, if we get the edges just right and we get just the look, the sleekness, if we're trying to wear it in a straight way, or whatever it is. If it's extensions, the stylist may want it to be a good value for us. So it's applied with some tension.
And that was my next question, because there's hurt, right? And then let's talk about heaviness. Because I know recently I think I went and got some braids done and it was so heavy. I had to remove it within that week.
Wow. And thank goodness that you did.
Well,
yes. Tension from weight is a big issue.
Okay.
Because I think that, with a lot of the styles that I'm seeing and that I've seen, progress over the last 15 years, we're putting in more and more hair. So it's not just, a weft here and addition here. No, it's like heavy. And even, for a while I was seeing like when I would see like full voluminous braids, often it was done with like a lighter weight hair, like Marley hair or whatever. But now people are going for this like really thick hair that also is quite weighted. And that is extremely dangerous for our hair integrity. Because, the idea is like, well, it hurts now because she just put it in, but then it'll loosen up. So you have to ask yourself, well, why is it loosening up?
Right.
It could be loosening up because it's literally taking your hair out.
Wow.
It's literally loosening your hair from the follicle.
And is everything.
Yeah. And so it may not be that the braid itself is loosening because she put it in there really well because she wanted you to enjoy it for a good long time. And that's the other thing is, I think we just have to reevaluate like what our intentions are, what our goals are. A lot of us want, hairstyles to serve as breaks from self-care. And that's hard too. That's hard because I think, taking care of yourself is important.
Right.
And we're all worth it.
Absolutely. So, and you're speaking definitely to protective styling, because I know protective styling can be doing more harm than good. So with CCCA, correct?
Yeah.
How do we treat?
Yeah. So with CCCA, the name of the game is really turning down that inflammation. Okay. So we know for many various disease states that inflammation is often what does the damage. And that is certainly true for CCCA. So the name of the game is to kind of hit that inflammation from various ways. So one thing is we often will approach it externally with the application of either topical or injectable steroids.
Okay.
And I know some people hear that name and you recoil, right? Because you're like, ooh, steroids, that's bad.
Please break it down. Please explain it to them.
Sure. So there are steroids that you take to bulk up and to gain weight as a bodybuilder, and those can make you kind of not feel so good and be dangerous to your body. And then there are other types of steroids that we use to reduce inflammation. And the ones that we use for scalp disorders, if they're injectable, we apply in very low quantity doses, okay? Low quantity and low concentration. Okay. So we formulate it at the patient bedside, and we inject it very carefully using very small aliquots, very small portions and tiny needles. Okay. It really doesn't hurt that much. Okay. And, but we inject it right into the area of the scalp where we see the inflammation. Oftentimes we'll go to the periphery because we want to just stop it. We want it to almost serve as like a line of defense.
Oh, wow.
So, no, you're not going to go into this other portion where we have some hair left. We want to put a perimeter there. So often we'll go to the active margin and then we'll treat kind of circumferentially in that area, because often it starts as like a small circle and it spreads outward and it can scar. That's where the name comes from, CCCA, central centrifugal cicatricial alopecia, meaning hair loss that starts in the center, spreads outward and scars.
So how quickly does it reduce inflammation?
Great question. It can take a few weeks, or it may take several months for it to work over time. So typically my protocol is I'll bring patients back every 4 to 8 weeks for those sorts of injections. And then if I don't think that they're appropriate for injections, I might even just send them home with a topical steroid cream that is also applied. So it may not always be the injections, even though if we really want to get after it quickly and aggressively, we often will reach for the injections first. The other thing that we'll do is offer oral antibiotics, just for a short period, a relatively short period, just to help reduce inflammation from the inside. It's not that we think that this is infected per se, but it's just that we use these medications for their powerful anti-inflammatory effects, because we know that time is hair. Time is hair. And so time with inflammation, unfortunately, can lead to progressive hair loss. And sometimes you can't get those follicles back. So we want to move quickly and aggressively. And then the third piece is typically, I lost my train of thought. Third piece is typically minoxidil. Okay. So topical minoxidil. So, and that's a 5% minoxidil that we usually recommend. And we can either get that compounded into a cream formulation or an ointment, or sometimes we'll go ahead and offer over-the-counter strength in the drops. And it's fine. As long as it's 5%, it doesn't matter if it says it's for men or women. And they also make a foam formulation. So Rogaine, go ahead. No, Rogaine is a really interesting product. Its trade name is Rogaine, but the brand name is Rogaine, but the base name is minoxidil. And I think it's one of the most misunderstood products in dermatology that overlaps with cosmetology. I think that oftentimes it gets a terrible reputation because people feel like if you start using it and then you stop, you're going to lose all your hair.
Codependent, yeah.
And that's scary, right? Because we don't want to do anything that we're like stuck to for the rest of our lives. But what really it does though is it helps to stimulate hair regrowth where we've lost it. And if you do elect to stop it, you'll just lose the hair that you gained because you were using it. You won't lose hair that you wouldn't have already, that you already had. So I really think it is a good option. It's available, it's relatively inexpensive, and it's predictable. You just don't want to get it on your face if you don't want to grow hair there, because you will. You will grow hair there if you are not careful.
And so my next question is, typically when someone comes to see you, well, I have a few questions. This can go on for a while because there's a lot. But when someone comes to see you, are you prescribing these 3 therapies at the same time simultaneously? Or is it, I'll try this first. If it doesn't work, you'll come back and then you'll come back?
That's a great question. It really depends on the patient. If the patient is, receiving this information for the very first time, and, we have to do a lot of base education and we have to walk through hair care recommendations. And, if we really have to start from ground zero, then we might elect to do one thing at a time. Probably my first thing would be the intralesional steroid injections or the topical. But I do not hesitate to also prescribe the antibiotics at the same time, because again, time is hair. And I just want to get after it and quiet that scalp, because oftentimes and one of the ways I try to distinguish what to do is I talk to the patient, I find out like what sorts of symptoms they have. I mean, clearly they're losing hair. We know that, but what are they feeling in their scalp? And that's a key, I think, for your audience to know. That if your scalp feels sensitive, if it itches, if it stings, if it's sore, and I describe it as kind of just being a busy feeling. Like if your scalp feels busy and it just feels like, man, so every time I turn around, I'm like feeling something up here. It just feels like there's activity.
Right.
Then that's not good. that's a warning sign. That's a warning sign, because your scalp you shouldn't feel anything in your scalp. It's like
and a lot of
arm, like you should just,
it's just time to wash my hair. It's just itchy because it's time to wash it. Or, maybe you think it's itchy from the hair or whatever. There's always, some people even think itchiness means growth. It's a good thing.
That's right. That's right. That's right. And so I guess I would help folks to differentiate that by thinking of it in terms of pain and sensitivity and burning. So, if you haven't washed your hair in 2 weeks and you are an avid, exercise person, and, you just need to wash your hair, right? Because it's like, it leads up to that wash day, and okay, fine. But if you just washed your hair, or if you're getting your hair done at the stylist, and when she gets to the top of your head, it feels really like active, and you kind of recoil a little bit, and you kind of wish she didn't do whatever it is that she just did, then that's a signal that maybe something's going on. And if it persists, like regardless of where you are in the hair washing cycle, like if you just got it done, if you just, it doesn't matter if it's there all the time, or if you just notice that over several months it's getting worse, then that's a signal.
And let's talk about results, because consumers are really into results. But can you define results, and how soon do people start to see results?
Great. So with central scarring alopecia, or CCCA, central centrifugal cicatricial alopecia, we really want people to know that partial success is just maintaining the hair that you have.
Wow.
So like that's the problem that we're up against, is that we know this thing can just rapidly progress, and if we don't stop it, it will take over. It will take over. You could lose, the full top of the crown. And so if you've got an area this large, and we're able to like stop it from spreading, unfortunately, you have to view that as partial victory. Okay. I know we all, like, typically our standard is everyone wants complete clearance, full regrowth.
Right.
And we want it as fast as possible. We want it in like 2 months. Like, I want my hair back, please, by summer.
30 days.
30 days, please. Thank you. But unfortunately, we do have to adjust our expectations. And you have to ask yourself, like, when I think back, I think about, maybe in college or with my first job, noticing like what I called a stress spot. Someone may have called it a stress spot.
Right.
And then you say, well, I did lose my hair after that one time with that one hairstyle, but then it came back. But then it's always been different. It's been thinner. And that was 7 years ago. And now the size is double. And so you almost have to say, well, it took 7 years to get into this. I would work with your dermatologist and say, absolutely, ask them how long they think it might take. But I'd say halting the process is partial victory. And I'd say that could take place over, 6 months to halt, over 6 months. And then perhaps to affect regrowth, it could take certainly years, anywhere from 6 months to 3 years, I would say easily. Right. And that's with a consistent amount of effort. Typically we see we get to know one another really well. And, it's an important relationship. You should find a dermatologist who you like, because you'll want to feel comfortable seeing them and telling them about how you care for yourself, how you care for your hair, what your practices are on a regular basis. And you don't want to feel like you don't even like them. You know what I mean? Right. So you want to find somebody who you feel like you can talk to easily, who listens and who understands what it is that you're trying to express. And then you have to be able to kind of take their suggestion and really, really do it. And, to do that, you have to establish a level of trust. So that person needs to earn that trust. And then you need to also trust them that they are giving you the best recommendations, and just please go with it, because they really they want you to be a success. They really do.
Dr. Hicks-Graham, you are giving me so many sound bites. When I tell you, when my editors get to this, you are giving us so many sound bites, and it's awesome. It's awesome what you're saying about having a great relationship, because this is a long-term hair journey.
Yeah.
So with that, the first question that comes to mind is, oh my God, expensive. How much is this going to cost if I have to do this for long term or a long period of time?
Yeah. So I really hope that health insurance in your area will allow this to be a covered benefit.
Okay.
Most of my patient visits are considered that for like the medical treatments that I'm describing. So occasionally it gets dicey with a procedure that we always typically recommend, initially called a scalp biopsy.
Okay.
So that's another procedure that you do have to figure in for expense. And typically that can range between like $200 and $400 once you consider the procedure and the pathology, which is where they take the specimen and then send it to the lab and have it evaluated. And that really is important when you're talking about any hair loss disorder, because you don't want somebody who's just going to look at you and say, oh, well, you have this, and this is what I think we should do.
Right.
Most of us who do this work regularly and who are passionate about it believe in the power of a good initial scalp biopsy. And that's because you really want to establish the diagnosis correctly from the front end. And, there are some conditions that can overlap. So you might think it's just plain central scarring alopecia, CCCA, but then there might be a bit of female pattern alopecia, which is another common disorder that we see a lot. It could be that there's a bit of a more, a less common, but also quite prevalent disorder called lichen planopilaris, or there's another one that can be associated even with traction alopecia, which is another common one, called frontal fibrosing alopecia. And that affects, it's a scarring alopecia that can affect the frontal hairline and can be confused with traction. And so you really want to encourage your listeners to get a biopsy done at the front end so that you can really plan out the treatments to be the most effective from the start. And so I would say in terms of price, every area is different. Most dermatologists do take medical insurance. There are some who are cash only, but typically I would plan for a medical visit with treatment to be around $200
Okay.
per session.
It's worth it.
What's that?
It's worth it. Absolutely.
Yeah, it could be worth it for you for sure. And hopefully it would be applied to your insurance. That would be covered by
yeah. And at the end of the day, what I always say is a sew-in is $500, $600 if you're getting a good one, right? I mean, we spend a lot of money on our hair and aesthetics, right? So it shouldn't cost you anything to actually save, your hair. Save
That's right.
your hair. Which is funny. You led me to my next question about your process of treating or your process of diagnosing. And you said that it's through a scalp biopsy, which someone, to answer the question in case they missed it, in order to get a scalp biopsy, you would have to schedule an appointment with a dermatologist. Your insurance may or may not cover, but the only way to know is to go, right? And so, but step two, I want to talk about really quickly because I know that, we're coming into some time. You talked about androgenic alopecia and you talked about traction alopecia. So I just want to address those two as far as treatment, prevention, as far as prevention and treatment.
Yeah. I'm sorry. It kind of cut out a little bit.
Sorry,
Can you repeat that?
Causes
Of traction?
Yeah.
Yes.
Of androgenic alopecia and traction.
Yes. So with androgenetic alopecia, typically that's something that we see in adult women and men, but certainly in adult women, it can be, very, very distressing because it's not culturally consistent with our norms that women become thin as we age. Men oftentimes can deal with that and they just decide to cut their hair and it's no big deal. But there certainly are some men who are also equally unhappy with the process. And so we do also do biopsies to establish exactly what the cause of hair loss for that purpose is for sure. So scalp biopsies are important even for what we can pretty easily, determine is female pattern hair loss. It has a different look. It's not scarring. Typically the hair is just thinner and finer and lighter. And so it tends to be a bit more quiet, and it does not hurt or itch or burn. And it also appears over a gradual period of time. Typically, it starts for men. It can start in the 20s. I've even seen it as early as the late teens. But for women, it tends to be into the 30s and certainly the 40s and absolutely into the 50s and 60s. So I have been seeing female pattern hair loss also at earlier stages. And I do think that, just hormonal changes certainly can be associated with that. I do find that there are instances where women of color are progressing into premenopause at an earlier stage. And so if you're approaching 40 or in your 40s and you begin to notice menstrual irregularities or more heavy periods, it could mean that you're beginning to enter premenopause. And so certainly female pattern hair loss can also begin around that time.
Wow. I mean, you have to come back for a part 2. Absolutely. Because there's so many questions as to why and how, and,
Yeah.
so how do you typically treat androgenic alopecia? What are some of the results? And then let's move to traction, because that's the edges. Everyone loves that. And I want to talk about dandruff and some good treatments that you have available.
Yeah, absolutely. So in terms of treatment, again, the mainstay is minoxidil. So the 5% minoxidil, it works. It just hands down works. But because it's not always appropriate for everyone. We also recommend considering, depending on the patient, oftentimes we'll use oral spironolactone, which is an androgen receptor blocker.
Okay.
So it's a low dose diuretic tablet that can really do a nice job on helping women preserve the hair that they have. And it can also add as an assist to helping to kind of boost those hairs. Also, nutraceuticals have become a real favorite for many patients with this. There are some brands on the market that are really good, not too heavy on the biotin, really, in terms of how efficacious it can be. I think it can kind of make things complicated at times and give people a false sense of, I don't know, not really security, but just that they're really doing something that should work. And I find that it just ends up not really.
Can you name an over-the-counter nutraceutical that you really believe in?
Yeah, I've been happy with Nutrafol. I've been really happy with that. They have some studies that do show that it increases hair follicle density and hair thickness. So we've been pretty happy with those results, and patients do continue to purchase it, and that always lets me know that it must work, because people wouldn't waste their money if they didn't think that things
Absolutely.
So yeah, Nutrafol I think is very good. Let's see. And then often we'll also offer platelet-rich plasma injections to help boost these hair growth efforts. And we'll often pair it with microneedling in advance. And that tends to do a lot for just encouraging a regrowth environment for hair.
Dr. Shari Hicks-Graham, where are you located again?
Columbus, Ohio. Yeah, come see me.
Columbus, Ohio to see.
Yeah, we're in the Midwest.
Female pattern hair loss, and it's been a battle. Hence why I created the platform, because it's still a battle. We're moving in a positive direction.
Good.
Sometimes we digress and then we go back forward. So it's really a journey. It's definitely a journey. So I want to talk about traction. Excuse me. I want to talk about dandruff. Oh, traction.
Oh yeah, I can hit traction quickly if you want.
Yeah, we can hit traction quickly because we love our edges.
I know. So traction alopecia is quite distressing. It occurs when people wear hair in styles that are fixed or too tight, using too much weight and pressure. And so what ends up happening literally is that tension from pulling on the hair just literally causes the hair to resorb over time and fall out. And so typically we don't view this as being a scarring alopecia, but it can result in scarring over time with total effacement, total destruction of those hair follicles. Mm-hmm. And so it's important to really recognize when this is a problem at first. Often it does not hurt. And so you're not going to get that signal necessarily. And it can happen if you wear your hair in the same manner every day, if you wear it up all the time or back or what have you. Certainly if you get with that brush and you have the edge control and you just are seeking that perfect finish,
Right.
it can be, it can be a concern. Also, if you wear your hair parted in the same direction and, trained, it can end up being something that can develop over time. And oftentimes it starts as a really young child.
It does.
So, absolutely. Like we all know that you can say, well, my hair has been like this forever. And you look in photos and you're like, well, I see that because,
right.
And again, culturally, we just have to really, really figure out how to balance like our cosmetic aesthetic, which we know is amazing. And like, no, we do not want to get rid of like little girl hairstyles. No, we don't. Like, we want those. It's all good. We love those, the volleys and the what. It's good. But it's just like how it's the manner by which we do it.
It's funny because I can attest to what you said, because I remember back in my perm days, oh God, when we used to do our doobies, right? Our wraps at night. And that one side to this day, it's you know how it is with the camera, but wherever it is on camera, to this day, it's that one side that seems like it's a little like a bald spot, because I used to always do the doobies the same direction religiously every single day.
But listen, it's about that though. Like it is that's a good feeling. Like you can kind of think back to the way that used to feel. And there was like some real satisfaction in getting that wrap right.
Right. Tighten that wrap. And you cannot put the pins in it because then it's going to leave the creases. Those days.
Don't let it slip the opposite way.
No, it would hurt if you have to put it the opposite way.
Well, or if you had it trained going this way. This was always my way. But then if at night, like your wrap shifted and then you had like a ridge
right
in your hair, and it wasn't
terrible. Now really quickly, how do you typically treat not edges receding, but traction alopecia? How do you treat that?
Yeah, so that's delicate. Some people will do intralesional injections of steroid, but you have to be careful because it can cause hypopigmentation of the skin. So you have to be very careful, and it can also cause little atrophy marks, like thinning of the skin there. And so it's reversible, but you have to be careful. So that is an option. Oftentimes I will elect to do like a topical steroid instead, just to avoid that. And if you catch it early enough, that can actually be quite helpful in terms of restimulating hair and reducing the inflammation, allowing the hair to come back, really is the mechanism. But then you can also use minoxidil there. And then also PRP is wonderful here. PRP and microneedling is
so
really
many people are afraid of PRP because of the pain, the pain. Yeah. And then you're told that if you use some kind of numbing injection or cream, that it would kind of interfere with the results of the PRP.
Yeah, it's tricky. I do use anesthesia. I usually do a combination of a cream that I get compounded that's kind of intense. It works well. And then it's effective, I should say, and it works well. And then I also will do little intralesional injections just so that people are more comfortable.
So you're going to get it all done while they're localized, right?
Yeah.
That's why absolutely. And this is what, once a month for how long?
Typically we do 3 sessions once a month. Yeah. And then we reevaluate at 6 months. And then, it could be that they might need a second series, but in many cases, people are very happy after the first session.
And for maintenance, usually just stop doing what you were doing to kind of cause the traction alopecia in the first place, right?
Yep. And that's the tricky part.
That's the one that, it's hard, there's so much we could talk about, but I really want to go into dandruff, because I will say this. Dandruff is one of those things where we're just like, it's not a big deal.
Right.
And can you please debunk the myth about dandruff and how serious it really is or can be?
Yeah. So I've been fascinated by dry, itchy scalp and those symptoms really as part of my whole journey in taking care of patients with hair loss, because I find that complaint, that symptom is something that a lot of our patients who experience hair and scalp disorders also have. Mm-hmm. And so I think that as part of good care of the scalp, you have to address the whole picture. And so if people have issues with dandruff, flaky scalp, I mean, there is just nothing worse. Oftentimes it can like come on the forehead. It can come behind the ears. It's like here, sometimes on the face. And that can be a clue, you know, if I see it on their face and if they don't offer up that they have the dandruff, because sometimes it can be an embarrassing subject for people.
Right.
I might just ask them and they're like surprised that I knew. And I'm like, well, I can just see that you might suffer with it here. So I imagine that it's definitely here. And, you know, it can happen in people who have perhaps a more overactive oil productive scalp. It might happen in people who have more of a quote unquote sensitive scalp, or that tends to be just drier if they tend to have eczema. Mm-hmm. And so it falls under this category of seborrheic dermatitis. And generally what that comes from is an overgrowth or an overabundant inflammatory reaction to yeast. Okay, so yeast, you either have high numbers or great sensitivity to this yeast, which causes you to have inflammation, which then causes redness and flaking and itching and dryness and, you know, what we know is dandruff. Right. And, you know, it can be really distressing because it doesn't feel comfortable. It doesn't allow us to maintain our hairstyles for very long, because maybe 2 days after you've had your hair done, you notice that you're still really flaky. And right. So, you know, the trouble with it is that many times the shampoos that we were giving patients to treat it were just stripping our hair of its natural moisture. And so right. I became tired of like, you know, prescribing these medicated shampoos for patients of color who have curly, kinky, thick hair that is difficult to go through a wash day with a poor product, right? If you have a product that is just, you know, it's good for the scalp, but then it like kills the hair, people aren't going to want to use it.
Right. And
so oftentimes I would recommend following up with a more moisturizing product. And it just became a real hassle because there were so many natural hair products coming on the market. And I knew that they were probably fine, but then I would find some issue with them. They might have too much this or not enough that, and too much fragrance, or, you know, just miss the mark somehow. And so I decided to develop a product to help people have a more simple way to manage their dry, flaky scalp. And so that's how I created Livso.
Okay. Do you want to show it highlighted or tell us where we can find it?
Yeah. So I happen to have a bottle right here.
Okay, awesome.
So yeah, this is a bottle of Livso. So Livso it's a shampoo. It's also a conditioner, and then there's also a moisturizing scalp lotion. Okay. And so 3-step kit, and it's all points are sulfate free and cruelty free and all the bad thing free.
But right, paraben free and all that free.
Yeah, right? Paraben free, all that stuff. So, but it has naturally derived ingredients that help to manage dry, itchy scalp in a way that's sustainable and effective and very just positive for people who have natural hair, whether it's natural, relaxed, what have you. Typically, it's for anyone with a curly hair type, is just what I say. But really, you know, it's good for anyone who just wants to maintain a healthy scalp.
Right.
And so that's really what Livso is about. It's available online at livso.com or on Amazon.
Oh, you're on Amazon.
We are, and we're the only official
videos. I love to highlight the best like Black-owned brands or best for curly hair, natural hair on Amazon. So we would definitely love to feature Livso on there.
Yay.
My question, you know, I always like to ask people, like, what's special about your brand? What makes your brand tick?
Yeah. So I think what's special about our brand is that we actually did studies that show that it was safe and effective for people over a 3-month period. Oh. So as a dermatologist, I felt that if I was going to bring something to market, I didn't want to just like run the studies out of my practice or give it to my friends and family, because I knew they might not be honest with me, right?
Right.
So we actually sponsored a study that was done like out of state with 35 participants, and it looked at them using the product at least once a week. They all had curly hair types, whether it was relaxed or natural. Over half of them were African American. And over time, they noticed a significant improvement in their dry, itchy scalp symptoms. And so, I felt comfortable once we saw those results bringing the product to market, frankly. So we do have science behind us. And I also feel proud that it is something that patients and that people who I haven't even met necessarily can go online and purchase and really get relief from. It's accessible. So the shampoo is like $19, the conditioner's 18, the lotion's 18.
Wow.
So, relative to like a prescription, which, you may or may not have insurance to buy, this is something that's accessible for people and it's relatively affordable. And, the shampoo is quite concentrated, so you don't need to use very much. And even though it's sulfate free, it does lather and it gives your scalp and hair just a really light, fresh feel. Yes. So that you can finish it with whatever styling products you want. Because I knew I didn't want to get into the styling game. That's not my thing.
Scalp is your game.
Yes.
And are there any active ingredients?
Yes. So, in the shampoo, we have xylitol, right, which is a naturally derived sugar. So it actually functions as being an anti-yeast, antifungal sort of product.
Oh.
Yeah. And then there's also glycolic acid in it, which helps to condition and also lift gently scales. And then we have just a bit of like our favorite moisturizers. There's aloe, there's a little coconut, a little shea, but it's really just about, also in white willow bark extract. So a little salicylic acid nod. So we carried these actives through the line. So in the conditioner, you'll also find glycolic, you'll find silk protein for strengthening the hair, and also Abyssinian oil, which is a more unique ingredient. It's a lightweight oil. So it's not going to, even though it enriches the hair feel, it's not going to feel heavy.
Right.
Because I know that we have all of our favorite products that you might add on the back end, but this is just to help with slip and detangling and conditioning.
All of it. You thought about everything. You thought about scalp health, the hair texture improvement. You thought about everything. And I'm really excited. And I would love to do a review on our YouTube channel about your products, because I'm always on the hunt for a shampoo and conditioner. I am not happy yet with a shampoo and conditioner. So fill that void for me, honestly.
Awesome.
I have one little funny question because I'm just curious. And then I just want you to tell the viewers where to find you again online. But my question is, I've been seeing this trend about putting Monistat on your scalp.
Oh my gosh.
I don't know if you heard about it.
Yeah. Is that coming back? Is it coming back?
I've started to see it. Yeah. The Monistat on your scalp. And I think Tiffany Haddish recently spoke about it on the Ellen DeGeneres show. So it's up there. So I'm curious, is it actually effective? And what are your thoughts about that?
Yeah, good question. I really think that it comes from the whole yeast thing. Monistat is something that we use for yeast in other areas. And so again, it just points to the fact that in many cases, these yeast forms can be implicated in some of the dermatitis that we feel and experience on our scalp. So while it's, it may be kind of comical to think about, really the element, the basis for the use is an understandable one. So I really can't comment on it negatively. I mean, I think it's probably, there's probably a little bit of benefit there. So, but I would recommend that you try the Livso scalp lotion.
There you go.
Because it was designed for your scalp, and you won't have questionable looks when you're putting something that's supposed to be somewhere else up here.
So scalp lotion it goes on after you wash and condition?
Yeah. So it is interesting because it's literally a scalp treatment lotion, right? So we always think about like a leave-in for our hair, but this is actually a scalp lotion that has a very lightweight feel that you can literally just kind of place directly on the scalp where you might have any flakes or irritation that you want to kind of relieve. And so you can put it on. The instructions are on the bottle, but basically you apply to scalp after washing and conditioning before you dry and style your hair.
That is awesome. We'll do a post on Live So, the lotion versus Monistat for your hair, for your damage.
Oh my gosh.
We'll do that. We'll definitely do that. We'll tag you and send it to you.
That is awesome.
Absolutely. Absolutely. We always think outside the box over here at Hair Scripts and Supernaturals, guys. Dr. Shari Hicks-Graham, this was one of my favorite interviews. I promise you. I could ask you so many questions all day, but I can't because we've already gone over time. So where can the Supernaturals find you online?
Yes.
And, yeah, go ahead.
Absolutely. I would love that. So I've enjoyed this so much. I would love for you all to follow me at Live So Life. So that's our Instagram page for Live So, at Live So Life. And then personally at Shari Hicks-Graham. And my private practice is at Downtown Dermatology.
Downtown Dermatology. And I'm going to stay connected to you and with you because I definitely want to come out there and check you out. I am so ready.
I would love that. Thank you so much. It was great talking.
Likewise. Take care. Have a great day and a happy Valentine's Day weekend.
You too. Happy Valentine's.
Bye.